the the overall generalized approach that I've learned over the last 11 years includes 4 elements that I've found are very uncommon. I've trained about 400 physicians on how to do regenerative therapies. And in that time, I've found about a half a dozen of them that are as enmeshed or as involved as I am in understanding all of the aspects of healing. And I've found that they boil down to 4 different aspects. Number 1, what I do is focused on what that person needs, nothing more and nothing less. It's not dictated by my ego. It's not dictated by what my center, which I own, says I should do. It's not dictated by what a book says that I should do, and it's not dictated by what a code from the AMA says I should do. It is what that person needs based on having treated thousands of individuals and done tens of thousands of injections. That should seem like it's a no-brainer, that we do what a person needs to have done. And what I've found is with insurance companies, with costs, with many different options for people, oftentimes what that person truly needs to be able to heal is, it takes a back seat to other forces, and here that will not happen. The second thing is understanding a very important concept, which is that there's a big difference between healing and feeling better. There are literally hundreds of different ways and interventions and whole thought processes and approaches that teach how to help somebody feel better. Your best friend coming, sitting down to you, putting their arm around you and saying, "How are you doing?" will make you feel better, typically. You get some endorphin release and you feel better. Meditating puts your brain into an alpha wave pattern and your pain will decrease. Understanding the difference between feeling better, i.e. pain being better, and fully healing is the crux of how I end up approaching most patients. Because healing will take into account the reasons why the pain and dysfunction is there in the first place. And if you're not working on the roots of the cause of and the causes of the pain and or dysfunction, ultimately you're temporarily making somebody feel better and making them dependent upon you, the practitioner. And everything about my clinic is set up to heal a person to the point that they don't need me anymore. I want to assess them so carefully, so well, and treat them so completely from both my perspective and a 6-step healing process from other practitioners, that they don't need us anymore, that they can live their life as they wish and want to. That's a very big differentiator, and when I see somebody in clinic, I oftentimes say to them, my job is not to get you to feel better. And then I long pause and let them wonder what I'm thinking, and then I launch this on them. I want you to heal. It's a very different process, and if the thought process starts from there, it changes and fills out what we'll need to do for each individual person, which was my first step. What do we need to do exactly for that person? The third item that's significantly different is a direct result of the second one, which is, if you understand the difference between healing and feeling better, and you take this healing pathway, I can't do that on my own. I can't copy myself and make a physical therapy version of me, a chiropractic version of me, a personal training version of me, a functional medicine version of me, and a psychological, emotional, energetic healing version of me. I found that the world can probably only handle one of me. And I need to employ and encourage and find practitioners who are very highly personalized and patient-focused to work with me on all those different approaches. Now, not every patient wants to take this approach, and some of them will look at me and say, I don't want to do that diet stuff. I don't want to do physical therapy. I don't want to change my hormones. I don't want to sleep better. I just want you to inject my knee. And I will do that, but I'll look right at them and say, it won't work as well, and you will be better, you will be back faster. In which case, you're not going to feel better and you're going to pay me more money. And I'll look at them at that point and say, what I'm telling you is not in my best interest. I could make more money if I treated people less completely. I want to treat you to the point that you don't need me anymore. And that being the goal, having the village to heal a person works far more effectively than me doing that on my own. The fourth differentiator in perspective at OrthoCure Clinic is an inspirational one. I'd known throughout my entire career that I'd have senses and understanding, sixth senses, on what I do for patients at different times. This is why 40 different conditions have very specific and very unique things that have been developed from inspiration and understanding through me. Some people like to say that's just my level of experience and how many times I do this, and that I think about it a lot, that these impressions and thoughts come to me on how to do things. Some people would say that's a God thing. Some people would say that's the universe. However you like to assign that piece of the equation, I actively seek to be inspired specifically for your condition, specifically for working on you when I'm assessing you, when I'm looking over your images, when I am doing your procedure. Everything is personalized around you and to your condition. No single knee arthritis is the same as anything else. Nobody's back pain is anybody else's back pain. And hyper-personalizing everything that I do requires me to be in a mindset that's very focused on you, and then trying to understand or feel or discern what the information that I'm getting at that time for you. There are other practitioners in the country that have been doing this as long as I have, who seem to develop a similar sense for people. And it's a known phenomenon. I talked to an orthopedic surgeon who actually looked at me and smiled and said, "That's just you being in the zone." And so there's a fourth way to describe that. However we describe it, it needs to be understood that I am using every direction that I can to treat you as completely as I can.